This is No Spin Live, and do we have a show for you today? We've got body trends and Victoria's Secret supermodels, and we have a surgeon watches football during surgery. And we've got some incredible plastic surgeons here to share their insights and tell us the real deal. We'll start off with Dr. Chet Mays from Louisville, Kentucky, Dr. Ned Snyder from Austin, Texas, fellow Texan Ned, and last but not least, Dr. Jason Pozner from Boca Raton, Florida. All right, well, JP, you lead us off. So, we're going to talk about this article on Victoria's Secret models. It's saying that basically, they used to be curvy, big busts, and now they're like, basically, if you read the article, it sounds like they're emaciated, like barely have any nourishment, and put chicken fillets in their bras because they have no breasts. So I don't know. What do you think?
I got a little confused reading the article because I looked at all the pictures and all the girls were pretty good looking. So back in the day, they were kind of taller and thinner, and then before that, they were a little bit more voluptuous, and now they look a little bit more fit. So, I think it goes by our times. Like, I think most of the women that are coming into our practices now want a pretty fit look. And I don't care if they got big boobs or little boobs. They sort of have that fit look, and they're not that mushy. So maybe the article was saying that some of the girls that they're seeing are fit, although there was a little bit of discussion over a week or two ago about Sports Illustrated versus Victoria's Secret, that Victoria's Secret only has this certain look of girls, and they don't have any of the any transsexuals. They don't have any heavier set girls like you might find in Sports Illustrated. But the discussion was in this other article was that, hey, it's a fantasy, and that this is what your fantasy girl should look like. Honestly, I think it's a big world. We got a lot of shapes and sizes. My preference in 2018 is I like the fitter side, girls who train. I think that's a little bit of a better look. Since we all do breast augmentation, I kind of like a bigger look there. But I'm all for fit with big boobs.
Chet, what's your take on this? Do you think this is legitimate? Is there a trend, or is this just how it's always been?
Yeah, so these are supermodels, so it doesn't matter what the trend is, what year we're 2008, we're 1998. These are some of the most beautiful women in the world who have been hand-selected to wear some of the most beautiful garments in the world. But yeah, if you definitely look at women and what's popular, not just in Victoria's Secret, but in magazines, they've changed. They've changed drastically from when I was looking at my father's Victoria's Secret magazine as a kid to where I'm in now. Definitely the women they're showing have changed shape. Now, as far as what personal look I like versus the other, I think just someone having a healthy lifestyle, whatever they can maintain, whatever their body size is, that's what's important. And now if someone comes in, BMI of 35, and they show you a picture of a Victoria's Secret model and that's their goal body, then you sort of have to step back as a plastic surgeon and think, okay, can I really give them what they're looking for? But as far as trends go, this is definitely one of those trends that has changed over the last few years as far as body shapes.
And Del Vecchio just comes and goes like with the wind. He just showed up, and actually, we're going to get your opinion on this in a minute, Dan. But Ned, so in plastic surgery, we know one of the things that we've learned in the past 5 years for sure is that sometimes fuller is considered to be more aesthetic, and whether they're talking about the faces or breasts or the butt. So fullness has been associated with beauty. So I don't know, this article goes a little bit against that, or maybe Victoria's Secret's standards do.
Well, it definitely does. It sort of talks about suggesting that just being thin and being, maybe not, somebody said emaciated. I'm not sure that's the right word, but overly thin, unnaturally thin may be a better word for that, is trending, and that included having very small breasts, minimal curves to the hips and waist, more of a I'm not sure the masculine is the right word, but an androgynous type body shape is what that article kind of suggested. And I guess you sort of see that in some of these women, at least compared to looking back when the women were much curvier. I think most of us in plastic surgery still sort of feel like that the having some shape has value, because that is something that as plastic surgeons we're able to add or help create. But it does appear that there are some tastes that are trending.
Dan Del Vecchio from Boston, Massachusetts. Dan, you probably came late just because you're still trying to recover from the Patriot loss this weekend. It was a rough one, but so listen, Dan. You know how to talk about fullness and how that equates to some trends now, certainly in the buttock this article from Victoria's Secret didn't find that. Do you think that is this just a company policy and not necessarily following the trends that we see in our practices, or what do you think?
I think three things really briefly, because I don't want to take too much airtime. One, the people who wrote this article may not necessarily reflect the opinions of the male species in WKRP in Cincinnati. In other words, this whole idea of the anorexic kind of wafy androgynous body is not in our DNA. It is not something that drives human attractiveness. It is the full breast. It is the full buttock. It is the full cheeks, facial cheeks. The third thing is, and I say this with all seriousness, Chet, what the hell were you doing with your father's Victoria's Secret magazines? Like, how friggin' old are they? Was your father keeping them in the basement or in the attic? Or were they in like a shoebox? Or were they in like a wooden box?
All right, well, listen, let's move on to this next story. Ned, I want to start off with you in this because this is about a Texan. This is a Texas plastic surgeon allegedly is being reprimanded or being investigated for maybe watching NFL football during surgery.
First of all, I know this guy, or I've met him before, which is maybe even makes that more remarkable. But I can't imagine that anybody would defend watching football while they're doing surgery. I mean, that's no different than watching a movie while you're driving. Meaning that we may listen to music in the OR, we may be doing other things, but listen to music in the OR is like listening to the radio in the car. It's, you can listen and operate, but you really can't operate without using your eyes or without being focused on what you're doing. So I don't think that's very defensible. Would have a hard time believing that's true, but I don't know. Yeah.
So, and I guess the other thing to segue to, because Dan, is there much difference, do you think, between, let's just say, I can't imagine anybody would want to watch a football game because, again, you need to be focused on what you're doing when you're performing surgery, and we all know that, so there's not really a debate about that. But we do have people that are filming, Snapchat videos in the operating room, and is that any different from watching a football game?
Oh, it's a hella difference. I can tell you that when I go on Instagram Live and my surgery is being recorded, I am probably the most meticulous and well-behaved because everyone's looking at me. It's live surgery. I'm not going to start being my usual self and like acting like a little, crazy guy and yelling and screaming. I'm going to be very, very calm. If they don't have what I have, blah, blah, blah. So I think it's definitely not anything close to watching the football game. I do want to pick up on what Ned said, because Ned is right. You can listen to music and use your ears and also do something with your hands and do it effectively and not put the patient at risk. But the minute you take your eyes off the patient and look at something visual, it's a no-no. And here's the problem. Every one of us in private practice now in our ORs, we have big flat screen TVs in the room to put the before and afters up. And it lends the temptation for somebody, either the surgeon or a nurse or some knucklehead, to put on Netflix or TV. And the minute you do that, you have crossed the line and you've put your patient at risk.
What do you think, Chet?
Yeah, it just comes down to distraction. So, we're plastic surgeons. We're good at multitasking. Everyone sort of has a threshold of what they can focus on. Some people can't, chew gum and walk at the same time. But some people can listen to music. Some people can have audio in the background. Some people can even have TV in the background. It just depends on what your limit is. But reading this article, it sounds like this surgeon's been accused of some other things. It wasn't just one time watching football in the operating room. It sounds like he was involved with a lot of other things. And I don't want people to come out and be like, oh, we got to remove all distractions, from the operating room. Let's get rid of the music. That's the problem. No, because some of these things are calming to people. We're very high functioning individuals, and, people are paying us a lot of money to do these procedures. So we do, it requires us to give us our utmost attention to what we're doing. And if, a football game in the background's taking you away from that, then 100% never, ever, ever have football in the background or something else that's distracting.
No, Dan got that from me. When Dan works here every once in a while, we have a big screen. Best thing he ever got in the OR was that big screen to put up mirror image and look at it.
Absolutely. It's awesome. And, it looks really professional. And like in rhinoplasty and breast, you want to go back to the pre-op because you know it can tell you a lot in the operating room. That's one value of the flat screen. But I can tell you that nurses have tried to put stuff on TV when I've been operating. It's like, absolutely not. Do not touch that TV.
We like, you know what, especially when you're doing eyelids, when you're really looking at lower lid fat pads and upper lids, we blow that up on a big screen. You can really see what's going on. It really helps us judge intraoperatively what to use. And we run it to a computer with mirror image, so it's all networked out.
Yeah, so Jason, this guy, I mean, he's from near Dallas, you know, I mean, if he's watching the Cowboys, I feel sorry for him because he's definitely distracted because the Cowboys are so bad. But maybe if he was watching the Dolphins, man, the Dolphins are they're doing a little better, so maybe he would be okay.
I want to know, first of all, what's this guy doing in the OR on Sunday in the first place by himself with a patient?
With no staff.
First strike. I mean, you know, it's like not happening during the week. The second thing is this stuff makes us all look bad. You know what? For the most part, every plastic surgeon I know is as you said, Chet, high functioning. These guys are dedicated. I don't know many charlatans out there. Everyone wants to do a good job for their patients, but when you have an article like this, it makes the patient a little bit wary. We all go into the operating room every single day and try to do the best job possible with as little distraction as possible. So, you know, if anyone here thought of watching a stupid TV show during a surgery, you say, like, that guy's crazy. How can you possibly concentrate? Our job is, while that patient's asleep, concentrate on that patient. And that's why, again, I talked about this in the past on the show. I really don't like doing these live Instagram posts that people are doing. I think they're getting distracted. Our job, focus on the patient, do the best job possible.
All right, well, that's great stuff. And you can see more of this on theplasticsurgerychannel.com.